lot of liquid.
That's gotta hurt. Holy cow. Look at the injuries that he ends up sustaining. The biggest and the obvious: open fracture of the right lower extremity and a massively torqued, dislocated left knee. This is a great example of why we do A, B, C, D, E.
A great many pieces of solid matter that form a hard floor-like surface. Ah!
Wow. Your brain and your mind immediately go to the scary abnormalities. You need to first make sure that airway, breathing, and circulation are appropriate before getting sucked into these extremity issues.
To the extreme!
Well, Meg has the mumps all right.
Oh, nice. The mumps is a virus. It's typically self-limiting. Classic symptoms of a virus: headache, malaise, fevers, body aches, chills, night sweats. You actually get this classic swollen glands, and we call those actually your parotid glands there, your salivary glands. So that's parotitis.
How is it she was never immunized?
Well, it was 1992, and I couldn't be bothered with anything that didn't involve Dan Cortez.
Dan Cortez.
Besides, what's a big deal? I never got a mumps shot.
Really? Well, I'd caution you that getting the mumps as an adult could result in serious complications.
We get the vaccine here in the United States, the MMR, when we're young, so we don't see this as often, but it still happens every now and then. If you do get it and you're unvaccinated, you have pretty intense symptoms.
You don't have a terminal illness. Oh, for God's sake, you don't have... Brian, what are you doing? Don't touch that. That's the infected Play-Doh. Brian, no, stop! There. Now I have cooties too.
Cooties as the terminal illness. I love it. Cooties, we've all heard of it, but it is just related to childhood myth folklore. Oh! Took it to the right elbow. You can have multiple different types of injuries to the elbow. It could break off the olecranon in the back, which is the pointy part of your elbow. It could have a epicondylar fracture, a supracondylar fracture, or you can have a dislocation. Need to check for pulse, splint it, and get x-rays.
Sorry, Mr. Quagmire.
I heard that bone break. My ears are fine.
Because of the way the angle is, you want to make sure that the pulses are good and equal. You're going to check a radial pulse, which is at the base of the thumb. You just don't want to push too hard, because then you're just going to compress it down and it won't bound up unless your blood pressure is really high, because it does relate to how intense your blood pressure is.
Hi, Chris.
Wait a minute, that's the girl?
Yeah, isn't she special?
That's the way the state of Rhode Island would put it. There's something up with her, isn't there?
Yeah, she's got Down syndrome.
Down syndrome is a triplication of chromosome number 21. Typically, there are two.
Right now.
Things that you would think for Down syndrome, maybe some developmental delay, but that's on a spectrum.
Doesn't she have the most beautiful eyes?
Well, the spacing seems a tad off, but yeah, individually they're not awful. All right, I'm on board. Go talk to her.
You can have structural characteristic changes to the face, which is what he's describing. There could also be internal things that you don't see, cardiac defects, there could be birth defects, or long-term medical issues relating to different aspects of the body.
I'm telling you, Chris is dying 10 times worse than those other kids. He's got a very rare disease called tumors, syphilis, osis.
Just put like itis, osis on the end. It's really interesting from a doctor standpoint. Same medications. There's a trade name and a generic name, or like the name of the medicine. As physicians, we have to know both. Different groups of individuals speak in different languages. So like pharmacists versus nurses.
Well, sounds sexy. What are the symptoms?
What are the symptoms? Take a look. He's growing nipples all over his body.
Those look like cut pieces of hot dog. Typically, people don't grow new nipples. Sometimes people do have an extra nipple out there, like a third nipple. Typically, it's smaller and not in the normal spot, which is fine. Most of the time, they're benign. You just leave it.
They look like pepperonis.
Who do you think you are? My son happens to be very sensitive.
They probably are pepperonis.
See, look, they're coming right off.
Peter, are you listening? Chris has a crush on his teacher.
Ew, gross.
You know what else is gross? Ah, broke a damn blood vessel!
This probably is just a very benign condition.
Benign and a half.
Called a subconjunctival hemorrhage. The white part of your eye, the sclera, and then you have the conjunctiva. Here you can pop a small blood vessel that looks really, really scary, but it's not dangerous. It's just a vessel closer to the surface of the skin.
Hey, look, it's Old Man Withers, the guy who owns the amusement park. But let's see who's really under there.
What? Is your skin easily pulled off like that? No. Have I seen it happen often enough where somebody degloves part of their skin off their hand or part of their head? I have seen that, but not all the way through. People have had face transplants where you actually put on the skin of another person.
A skeleton!
Can I have my face back?
No, you're going to jail.
Wow. They do a fun depiction of the skeleton. See that the nose is gone because the tip is cartilage, but there is some bone at the bridge here. You even see some vertebrae in the back. The ears are gone as well. You just have holes on your skull on the side.
Where are your ears?
Do I sound sexy? Tell me I sound sexy.
Peter, what the hell? You look terrible.
Peter does look pretty bad. He looks pale. He's got this like fluid on him. Maybe it's just sweat. In the business, we call this a diaphoresis.
We're off the couch, kids. I'm gonna do your mother right here.
Oh.
my God.
We don't see that much projectile vomit in the emergency department. When we hear of a kid having projectile vomit, especially like a newborn, then you think they have pyloric stenosis, too tight of a muscle and not allowing things to pass through the stomach. So, oh my gosh. Don't pull your own IV out of your arm like Peter just did. You're gonna start bleeding everywhere. Remember, there's a hole in your vein now. If you're angry, if you want to leave against medical advice, that is fine. If you are in the sound mind, you are allowed to do that here in the United States, and we will take it out for you and put a bandage on there. What the?
Gotta keep the tan up.
Tanning beds, no, please don't use them. They increase your risk of skin cancer, so please don't do that, as well as burns and injuries. There's really no benefit to it.
Hey, wake me up in 15, will you, babe?
Fine.
I mean, at least he's using eye protection. It's also a child, which this would never happen.
Just to get a base.
Oh, crap, Stewie!
Oh no, oh my gosh. Oh, that's the worst. Has anybody had a bad sunburn? Oh my gosh, I remember when I was like 20 years old in college, I went to the beach with my buddy. I got sunburned and I couldn't even have like a sheet on my skin. It was so uncomfortable. And then eventually it turned into like second-degree burns where you get the blisters and the skin sloughs off, so to speak. It was awful.
Hey, buddy. I was just coming to tell you it's time to get out.
I've been in there for 6.5 hours, you son of a... Don't touch me!
And I know that the pain with the walking, because if you try to bend your joint, it stretches the skin and it hurts.
Get the lotion. Put the lotion on me.
Ryan!
Lotion sometimes can help. Aloe can help. It gives a cooling sensation. At this point, you're just trying to use things that will make you feel better and soothe. Your body needs time to heal itself.
Ew.
Hey, Brian, you want some Stewie jerky?
Oh.
That's not good. Our skin shouldn't really do that very often. If you do get exposed to sun a lot and you might get burned a bunch, even by accident, definitely have like regular checkups with a dermatologist, so that way somebody's monitoring your skin, not just in the areas that you can see, but everywhere, just to make sure you're not seeing any skin changes.
I'm just glad I stopped before I did any real damage to my skin.
I wouldn't be so sure.
Yep.
I don't remember you having that mole before.
Oh, there's a mole there.
Well, the mole looks benign, but we won't know for sure whether it's cancerous until the tests come back in a few days.
A few days? I could be dead by then.
So then they say, okay, what tests do you do when you have moles or skin lesions? They're biopsies. They're gonna take a sample of it and test it to see if it's cancerous or not. Hopefully, it's benign.
We have a winner! Ladies and gentlemen, Yamamoto has finally been defeated!
All right, Chris.
Chris, you did it. You're a champion. And now you get your pick of the groupies.
41 hot dogs is a lot of hot dogs. Hot dogs are not good for us. Just eat in moderation if you want to. Eating contests, you'd actually be surprised a lot of these individuals are actually quite skinny. They've trained their bodies in such a way to metabolize the food. The stomach has been stretched, as the stomach is an organ, but it's also smooth muscle, so the muscle can stretch.
Hello, neighbors.
Oh, that's hilarious. That's the American Dad.
How do you do? I'm Stan Smith.
Stan Smith.
The hell kind of dog is that?
That's our alien Roger. He lives in our attic, but nobody can know.
Hello? Oh, hey, Quagmire. Hey, you're not going to believe this. I'm over here with Joe, and he's got a space alien.
GSW's to the chest. Got one onto the right, the left, and one in the midline. Could this injure somebody to where you drop that fast? Potentially, but you're gonna be more in discomfort, pain, drop, and then you're going to be bleeding within the chest itself.
Hey, Ambassador Mombasa, are you enjoying that new soap I bought you from that mysterious Chinese man whose store was weirdly not there the next day?
Oh, jeez.
Ambassador Mombasa?
Oh my gosh. You do have to be careful of bathtub injuries. We all know about electrical injuries and don't have like appliances near the bathtub. We see injuries when people like slip and fall.
Oh my God, Ambassador Mombasa!
It looks like the ambassador's eyes are quite injected. We'd say scleral injection. So the sclera is the white part of the eye, and when we say they're injected, meaning they look very red. Sometimes people can have the vessels on the sclera pop, and that's called a subconjunctival hemorrhage. It's not dangerous. The most common injury that we see in the bathroom, there's two. One passing out in the shower, and then the other one is passing out on the toilet seat. The issue ends up being there's a lot of sinks, toilets, hard objects that you can fall and smack your head on. Oh, that's the worst. You can break your jaw, you can break the zygomatic arch, you can break your skull, you can break the maxilla. A lot of different areas that you can definitely break with this type of injury. This head is facing the opposite direction. Necks don't do that.
I can't do that!
That's just not really compatible with life. And that's a lot of blood pooling. A lot. That looks like his whole body of blood. Most people, 8 to 10 pints of blood, a couple liters of blood in our bodies.
Everything okay up there with the bath?
Oh, we got a flood. Oh my gosh. Falling from one story like that increased the risk of cervical spine injury, intracranial hemorrhage, skull fractures. This person would be transported to the hospital in a C-collar, probably a long backboard, depending on the service you have, your EMS system. Come on. Come on. Impale the object to the eye. Would you leave it in there? I would probably still say yes, because you can still be transported this way. If you quickly remove it, you're going to remove all the fluid out of the eye. But again, we're probably going to do something similar. Really hard to get ophthalmologists to see patients in the hospital, but that's because their equipment is mostly at the office.
What happened to your clothes? Hey, what are you doing?
Oh. In the emergency department, we actually do have to deal with batteries being ingested or put in certain areas. These type of batteries, not as bad as button batteries, could be quite caustic to our body, get stuck and start eroding and causing perforations in our GI tract somewhere.
Brian, have you seen... Whoa, what the hell happened to you? Oh, easy, man, easy.
Wow, interesting. Strangulation, you're cutting off blood supply in and out of the brain via your carotid artery and your jugular vein. And then you're also compressing down your trachea. So the trachea has cartilage. It doesn't go all the way around, which makes it easily compressible.
Don't you see, Brian? My machine did work. It created an evil clone of me.
Stewie here has cloned himself. I know back in like the 90s, they were able to clone the sheep, Dolly. You think they've cloned humans? Since then, why don't we all put on our tinfoil hat and let me know in the comments what you think.
We're going to run a few tests on...
Oh. Remember, when you get a bloody nose, pinch the nose and lean forward. Do not pinch the nose and lean back. If you lean back, the blood's going to trickle down the back of the throat into your mouth. You're going to spit it up. You might get nauseous to where you vomit. Oh, no way. I've never seen this episode or heard of this episode before. That is crazy. Do not cut the dog's tail. It's part of like their spinal cord. You can even see the bone that is in there. Oh my gosh, I can't believe they put the tail in the mouth. It's like pin the tail on the Stewie. That is awful. Having traumatic head injury, you already see a black eye forming, a bruising to the head, and then with that, you can even choke on the foreign body that is in the mouth. And I do like that he's pulling on the few strands of hair. It's kind of funny. Stuart's puking. Oh my gosh, that's funny. Poor Brian trying to stick his tail back on. If there's enough blood supply, you could potentially reattach this as long as there's no other higher level function going on, but you have to attach all the different components, the muscles, the blood vessels.
Oh my God, a baby! Are you okay?
What? Look at the anatomy. They do a pretty good job. The separation of like the nose, the oral pharynx, the brain, and all the tissue and skin around it, and then depicting bone. It's actually pretty good.
I'm Dr. Wagner.
Stop it! There's a Dr. Wagner in Family Guy? I didn't know this. Why didn't anybody tell me this? Kind of looks like me a tiny bit.
This is so stupid. You're stupid.
Guys, please.
Admit you exaggerate your accent. Admit you wear shirts from museums you've never been to.
Psychiatrist, psychologist. In the emergency department, we don't deal with these situations often. We would end up dealing with the injuries if they got into a fight in the office or, say, in the hospital.
It is my opinion that you should end this friendship.
What?
Fine by me. Makes my life easier.
Also, your insurance card didn't go through, and when I looked again, I realized it was a Robex juice card.
You went to SUNY Albany. You'll take it and like it.
I don't think a professional should weigh in so much on their opinion when it comes to this aspect. You typically want somebody to come to their own conclusion versus you actually telling them what to do.
This is not good. No one knows we're out here, and we got no food or water.
Relax, Quagmire. There's food all around us. The trick is just knowing what's safe to eat and what's not.
Oh, jeez. Don't...
Okay, these are a maybe.
There are some different disease processes that cause like a desquamation or a dryness and cracking and pulling away of skin around the mouth, Kawasaki's disease, but toxins, there's a whole other specialty within emergency medicine called toxicology.
I feel dizzy.
Oh.
Me too. This all happened so fast.
No, she feels dizzy, bro.
Jess, are you okay?
In general, if you feel dizzy, you get tunnel vision, sit down, lay down. These are the precursor signs that something's going to happen, typically a syncopal episode. A lot of people have the sensation that they want to run away and then they fall. Lay down, sit down on the ground, get blood flow to your brain, you will feel better.
Jess?
So lay Jess down all the way on the ground and double check to make sure she's breathing. Make sure she has a pulse.
Are you guys still leaving?
Oh, yeah, sorry.
Not so much. It's a good depiction of how difficult it is to move a human being. We are heavy and awkward to try to lift and move.
I'll come right out and say it. The cancer did not respond to treatment and has spread throughout your body. You've got approximately 2 weeks left to live.
It's so interesting when we put a time on somebody's expected life. It is a very rough estimate. It is not written in stone. Unless there's like an immediate reason that somebody's going to pass away within the next 30 minutes to a couple hours.
So, what seems to be the trouble?
Dr. Hartman, something's wrong with me.
Oh.
Everyone's treating me like I'm a broad.
Sounds like someone's having their monthly.
Oh my gosh. Dr. Hartman, you all know my opinion on Dr. Hartman, basically stating that it's the potential female menstrual cycle.
All right, sweetie, let me just spit on my hand and we'll get started.
What the heck? Potentially a pelvic exam. You should be using gloves. You should have a female chaperone in the room, have the patient covered appropriately. And also, you want to make sure that when you're doing this type of exam, the patient is not facing the door in case somebody comes in.
I wouldn't be standing here right now if it wasn't for you.
Oh, shnikes. Getting hit by a truck, you think, okay, massive internal injuries, fractures, and bleeding.
She's right in here, sir. Just tell the disorderly when you're ready to leave. Don't you mean the orderly?
The orderly. We don't even use that term anymore, the orderly. And it's not disorderly, it's orderly.
Brian, I don't have much time.
We have the EKG machine, which is only showing 1 beat per screen. Maybe it has a number hidden somewhere on that monitor, even though it says 0. Even if the monitor says it's 0, check the patient to make sure they have a pulse.
I never should have made you leave the house. This is all my fault.
Shh. Don't be so hard on yourself.
The nasal cannula, it almost looks like the one from Dune, only one-sided with the double prongs to the nose. The normal one nowadays is a loop, so the prongs go into the nose, but the tubing comes out both sides.
I only wish we could have a little more time together.
Quite interesting that she doesn't have any outward injuries, but she did get hit by a truck.
All right, Stewie, time to go.
What the? Oh.
A little wobbly. Guess my legs fell asleep.
This is not an unusual event to happen where somebody's sitting on the toilet for a long period of time and their legs go numb, compressing some nerves and blood vessel down enough to where you have difficulty walking.
Stewie, Daddy can't feel his legs. Go get help. I'm hanging from a door, you idiot.
I always advise people, like, just stand up, stand there, and don't try to move, or like stand and kind of move the legs in one position. You try to walk, you might run the risk of falling. Just take your time, balance yourself, that sort of thing. Oh no! People come to the emergency department because they've lost consciousness or they smacked the back of their head. More commonly, you can have just like a hematoma or a bruise to the back of the head there. Some ice, a little bit of pain medication, everything's gonna be okay. You could also have a laceration to that area. Sometimes it goes all the way through the tissue and we need to suture it back together.
By the way, you're down to 5% battery.
Worst case scenario, you have a fracture of the skull itself or you have intracranial bleeding. Most of the time though, because it's a posterior direct hit, you don't have bleeding. It's more injuries to like the side of the head. With somebody like this, in this scenario, we'd probably end up getting a CT scan of the head.
God damn it, my head.
There he is. Welcome back, buddy.
Who are you?
I'm a paramedic.
If the EMS gets to the scene, you're gonna check vital signs. If they're unconscious, you're not just gonna wait around. You're gonna get them out of that scenario, get them to the back of the ambulance, and if they're still in bad shape, you're gonna get them to the hospital.
Sir, you sustained a head injury. How many chicken fingers am I holding up, and do you want one?
3 and hell yeah.
You're not gonna give them food, you're not gonna give them drinks. People actually get pretty annoyed at us because most of the doctors will keep them NPO, nothing by mouth. We don't want to have you put something in your stomach when there's a chance that you're nauseous and you're gonna vomit, which increases the risk of aspiration into your airway. And then the other component of it is it could block your airway.
I want you to feel that your heritage is respected here. So I've made a few tweaks to our favorite classic television show.
We now return to ER.
Edited for Eastern medicine.
I need 10 cc's of
ginseng root.
And somebody set this patient up with
goldfish to nibble his toes.
What? Somebody is being bagged, is what we call having assisted ventilations with a BVM.
We're gonna lose him if we can't get our hands on some baby elephant bones.
CPR is started. You're going to use normal ACLS protocols, which include respirations, chest compressions, and medications. Very few medications are available, approved when the heart stops. Epinephrine is pretty much the biggest one that you would use.
A lot of hungry deer walking around at this hour of the night. And, oh, here's where the story gets fun. You may have noticed I'm missing an ear.
Oh no! People come to the emergency department often enough that where they do have ear injuries. Now, I've been doing this for 15 years, probably seen traumatic ear injuries maybe 5 times. It happens, it's not like massively common.
Managed to pull it out of the deer's mouth and put it in some ice I got at a 7-Eleven. So when you're ready to apologize, just talk into this cup.
You have to stop the bleeding, control that area, make sure there's no trauma to the ear canal and the eardrum.
Oh, I don't know, Glenn. Are you sure you can handle me?
Better question. Can you handle me?
Whoa.
All right, let's load him in.
The white parts of the eye, the sclera is all red and the blood vessels are intense. Could be, you know, infection versus like stress. We got a lot of sweat going on, super pale. When somebody is like really pale, we think, okay, they're really sick. Did they have bad blood flow? You know, not good, but he's got a big smile on his face.
What happened?
OIA, orgasm-induced aneurysm.
What the heck? Aneurysms, where the blood vessel is weak and has expanded, increased risk of actually rupturing. People will have brain bleeds when that happens. Sometimes you can find that somebody has an aneurysm and you can treat it before you actually have a rupture. You have an interventional radiologist put some metal coils into that area.
Poor guy slept with someone out of his league.
I gotta say, his elbows look perfect.
Thanks, Sky Rizzy.
Do some people have events after orgasms? Yes. Sometimes you can have strokes after an orgasm. You can have electrolyte abnormalities. You can have cardiac arrests that occur.
Cardiac arrest!
When somebody's working hard, the heart is working really hard during encounters with another individual. Oh! Baseball bat injury to somebody's head. It does happen, or just trauma to the back of somebody's head that gets knocked out. Definitely going to be a CT scan of the head and the neck.
Stewie, help me!
Oh, that's awful.
That's awful.
Brian already has an injury to the right leg in a wheelchair, falls out window. It's like 2 or 3 stories. When you fall out of the window like this, more than 3 times your height, it's good to go to a trauma center. You suspect that there's a significant amount of injury.
Brian, are you okay?
Yeah, I'm fine.
Annie, are you okay? So, Annie, are you okay? Are you okay, Annie?
What happened to her?
She was struck by a smooth criminal.
She was struck by a smooth criminal. Let me know if you know the song. multiple people are in the same area. A lot of times the hospitals have, it's a semi-private room where there's 2 individuals there. Versus in the emergency department, you usually have separation by curtains.
Oh my God, Peter, what happened?
What happened? A fair question. And to answer it, we have to go back a ways.
Stop doing that thing!
Peter looks very red. Either having an allergic reaction, got exposed to too much sun. Usually when you're red like that, very painful, very uncomfortable.
Brian, I think my jaw is falling off.
Oh no, the jaw is gone. That is awful. It doesn't just randomly fall off, but I've seen a lot of patients come in with like teeth falling out or broken jaws. Not too much dislocated jaws. Your jaw is not just gonna fall off, because then it would be a lot of lacerations and bleeding in this area. That's not very common.
Stewie, what is happening to this thing?
Oh, yeah, turns out the clones aren't too stable, Brian. I've been having some trouble with mine, too. Hey, Stewie.
Oh my gosh, look at the eye just coming out. Normally, your eye is just not hanging out by one thread like this. You have 6 muscles that are attached to the eye, plus the big nerve attachment in the back with blood vessels.
Yeah, I figure they've got less than a minute before they dissolve completely. Hey, Brian, knock, knock.
Who's there?
Oh gosh, our bodies just don't melt like that. Say somebody had a clone and it wasn't working out. Typically what'll happen is maybe a bleeding disorder or a cardiovascular event, but you're not just gonna disintegrate.
I am so sick of this. Joe is just gonna keep bailing on us until that baby comes out of Bonnie's butt.
Okay, first of all, we all know that babies do not come out of a butt. They grow in the uterus and they come out the vagina.
Well, we are gonna do something about it. We are gonna figure out a way to induce labor and make Bonnie have that baby.
You can induce a pregnancy. Most of the time, pregnancies last typically 39 to 40 weeks. So almost 10 months. Sometimes we don't like when the baby stays in longer, so you can be induced multiple different ways.
I'm here to induce birth. Follow me. Now, I'm gonna put the TV remote down by your feet, and I'm gonna turn on 2.5 Men. If your baby isn't totally brain dead, it'll come rushing out to change a channel. And when he does, I'll grab his hand and yank him out of there.
If an arm is coming out first, that would be a breech position. So anything that's not the head coming out first would be breech, basically, by definition.
All right, Mrs. Swanson, you're doing fine.
There's a lot of people in this delivery room. Typically, it's not that many. Usually not just regular random friends.
Okay, here we go. Hold on, the wheelchair is coming first.
Wow, that is so messed up.
And here's the baby. Congratulations, Mrs. Swanson. It's a beautiful baby girl.
So they got the umbilical cord, great, but babies are typically covered in kind of a white film due to being inside the amniotic fluid for such a long period of time.
Well, good news, Griffins. Brian is going to be just fine. I was able to remove his tumor. And if anyone wants to keep it, it's here in this Tupperware.
This is half of a chicken cutlet.
Oh, boy. What did I have for lunch?
Oh, gross. Yes, we will save products of a person. Majority of the time, we send it to the pathology department so they can analyze it to see what it actually is.
I missed you, buddy. Welcome back.
Thanks, Stewie. You never gave up on me. You knew that wasn't really me.
Yeah, well, it's no big
I mean, I was having fun, making new friends, getting laid all the time, sleeping like a rock, but you made the call.
So really interesting, describing personality changes relating to probably some sort of brain tumor. A lot of times that's relating to your frontal lobe. There's a type of brain tumor in humans called a meningioma that is a space-occupying lesion that's actually growing, not in the brain tissue itself, but pushing the brain tissue as it's growing.
Hey, Lois, guess what? I had them do that 2-wiener operation on me. Double trouble! Uh-oh, that was the original.
What? What is this? Is there something called? I don't even know what that is. 2-wiener operation. No, that is not a thing. There is a very rare genetic abnormality where somebody has penile duplication, diphalia. Basically 1 in like 5 million. It's like a ton. So it's super, super rare.
God, it's so damn hot.
Hey, I got an idea. Let's make scalding asphalt angels.
Oh my gosh, come on.
Come on! second-degree burns.
Holy cow, that is not a second-degree burn. Probably more closer to a fourth-degree burn. A third-degree burn typically will still burn the skin, but won't have it slough off like that. It'll be like a white, leathery kind of look to it, versus now we're seeing bone underneath, so now you're getting into way deeper levels of tissue.
I'm sorry, Mr. Griffin, but I can't baptize little Stewie today. It turns out our last shipment of holy water is tainted.
Tainted?
Ooh.
Holy water? How would that happen?
Somebody peed in it? No. Oh, I see this quite often. People not washing their hands, and that's pretty disgusting. When you're finished using the facilities, please wash your hands. Not doing it all is gross and disgusting and spreads germs.
There's no such thing as tainted holy water. Come on, we'll do it ourselves. Stewie Griffin, I baptize you in the name of the Father, the Son, and the Holy Ghost.
And Space Ghost.
What are you doing? Oh my God.
Oh no! Lots and lots of things can live in water, and you can get bad bacterial infections, viral infections, parasites, lots of different things.
Mr. and Mrs. Griffin, I've examined your son, and he is suffering from a temporary toxic anemia, which has substantially weakened his immune system.
Anemia basically means that your red blood cells are low. We test this by not looking at the RBCs actually, but by looking at the hemoglobin and hematocrit. It's a more accurate marker. We can tell by different levels how low it is. Temporary toxic, so he's saying that there's a toxin that caused this.
Is he gonna die?
No, but he's highly vulnerable to infection and must be quarantined in a germ-free plastic environment.
The boy in the bubble back in the day was John Travolta. And then there was Bubble Boy, which was Jake Gyllenhaal. It is a true medical diagnosis, very rare, but can occur. We do treat individuals kind of similarly like that when they're neutropenic, and that usually occurs from chemotherapy-induced issues.
Stewie, just watch your show upstairs. I don't want to watch it upstairs on the small TV. I want to watch it downstairs on the big TV. I want to watch my show. No!
Typically don't get a red face when I get angry. I get a red face when I get embarrassed, so I will flush. We have tears coming down. When you actually cry, the increased amount of tears coming out will actually go down into the nasal cavity itself and will actually cause you to have the runny nose. It's from the tears, not from just regular snot.
What's all that noise? Oh, do you want a hug from your big sister?
Oh, man. Okay, temper tantrum gone wild. Bloody nose, broken, crinkled nose. Majority of the time, it is straight. What I tell people is pinch the nose and lean forward. Blood will pool in the nose, clot, and stop bleeding. You don't want it to go backwards because it increases the risk of vomiting, aspirating the blood into your airway. Not good. You just want to get it to stop.
Oh, look, my box of ribbons I've saved from various presents. Oh, I'm not throwing that out. That's a good ribbon. This is a good ribbon, too. These are all very usable ribbons.
Hey, little guy, how's the sorting going?
I'm not getting rid of my ribbons.
Oh! Does the arrow go all the way into the brain? If it does, going through the eye into the frontal lobe, will it kill you per se? Not necessarily. It will cause brain damage, bleeding around the brain.
I just wanted to know if I could borrow a ribbon.
Wow, wow. Bone structure around the eye is thin, and then the eye itself does have blood vessels that go into it, but it's mostly fluid. But the minute the retina gets damaged like this, then you're gonna have permanent vision loss in that eye. This is amazing. There's so many medical scenes that occur in this show. It's been going on for so long, but very relevant medical cases I've seen.
You're addicted to television, and you're not exactly Mr. Cold Turkey either. Remember that time you tried to give up candy?
I'll ask you one more time. Are you sure you didn't eat anything in my factory?
No.
A few moments later.
People can get addicted to anything. Fitness, exercise, the stuff that we worry about, alcohol, or even different foods.
Just asking.
What are you, calling me a liar?
No, I'm just saying.
Hey, shut up!
Violet, 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 you're turning violet, Violet.
Violet, you're turning violet, Violet!
More often than not, if somebody starts swelling up after eating something, that's an allergic reaction, treated with an EpiPen, especially in that situation. There's other medications that we would use, such as an H1 blocker, an H2 blocker, and a steroid.
Watch Stewie for a minute.
Sure.
And please keep a close eye on him. Remember what happened last time.
Stewie, get down before you hurt yourself.
Shut up! You're not my mother!
Good God, are you all right?
So very interesting. The skull itself isn't permanently shaped until we're older, like later teens, early 20s. Because of the suture lines, they're not totally fused until later. I don't know if anybody's seen, but there are like kids that wear those little Tron helmets. They're shaping helmets to allow the skull to reform into the more rounder shape.
The principal cut sex ed class to save money.
What? Well, that's crazy. Without sex ed, kids can wind up sexually confused.
Sexual education is definitely really important at the home or in school. It's really important to know the potential consequences of sexual relations, especially if you're young, so you understand what could happen, aka a baby or permanent viral illnesses.
Just look at Michael Jackson.
The kid in me likes the frosted side, but the grown-up in me likes the kid in me.
Okay.
I got a job following fat people around with a tuba.
That's so messed up.
I have a glandular problem.
He says he has a glandular problem. Majority of the time when people are discussing that, they're talking about their thyroid and being hypothyroid. Not having the normal amount of circulating thyroid hormone can cause weight gain and make it very difficult to lose weight.
You will die in a plane crash and be reincarnated as a prophylactic.
It comes back as a condom. A prophylactic in general is something to prevent a disease, an injury, or a problem from occurring. There are different prophylactic medications. You might have a prophylactic surgery, vaccines.
All right. No, not all right.
It was good in this scenario that they were using protection because it helped prevent the spread of sexually transmitted diseases.
If you're that hungry, go down to the dock and find Daddy and we'll get dinner started.
You're not going to get dinner started. She's going to tell that sloppy old Spanish maid to do it. And she will, but only because she needs money to pay for medicine for her prematurely overweight son, Diabeto.
You can be born as a type 1 diabetic where you don't produce insulin and you need to have insulin versus somebody who is a type 2 diabetic where they basically over time actually burn out the cells that produce the insulin.
Mama, may I have cookie?
No, Diabito. Roll back to kitchen.
Oh.
Oh my gosh, oh my gosh. A lot of stereotypes there, but you have to be careful giving too many sweets to the younger population because then we're setting them up for early diabetes.
I'm good in a crisis. After all, I used to work the suicide hotline.
I just can't take it. I discovered my wife's been cheating on me for a while. I have to kill myself.
Doesn't it make more sense to kill her?
Oh, that is a thought some people would have in their head, but not the appropriate thought. We do have hotlines for people who are feeling anxious, depressed, or suicidal, or even homicidal, and have a conversation with somebody who's trained versus Peter.
We can't have a bat flying around the house. We gotta do something.
If there's a bat in the house, if you don't know how long it's been there, sometimes there's a concern about rabies. Bats can carry rabies, and you don't necessarily know if a bat has bitten you because their teeth are potentially really, really sharp.
Don't worry, Lois, I'll get rid of it. It'll be a piece of cake, just like my penis enhancement. I want it to hang down to my knees. They moved up my knees.
Trying to make your genitals larger, very hard to do. There are situations where you can actually have a penile transplant if there's a micro penis or other issues relating to it.
Be more careful next time.
I know, what a stupid injury, huh? I haven't been this embarrassed since I was a rookie firefighter.
Oh gosh, what happens?
Sorry, first day, still learning.
Peter has bandages to his head. In a lot of shows and movies, you see people with full bandages like that to their head. We don't typically put these on individuals long term. You gotta suture something up, glue it closed, or staple it shut on the scalp.
He suffered severe head trauma. So if you want to beat him in Mario Kart, this is your chance.
And the champ is dethroned.
He has some sort of traumatic brain injury. He might have a little bit of bruising to the brain. It might make him a little bit concussed or a little bit still out of it. Sometimes people can have head injuries where they have transient global amnesia. It's temporary where they don't remember things.
Where am I? Until the Board of Health gives the okay, you're done.
Wow. I actually got the place shut down.
Toxoplasmosis is an infection caused by a parasite with a very similar name, having picketing in front of a window with cats, because cats can spread or transmit this parasite.
We've hardly done anything together since we made that fiber commercial and had to use code words for pooping. Just 2 spoonfuls a day to stay regular and active.
More coffee, Stewie?
Yes, please. Oh dear, that was a mistake.
Make sure if you're using fiber that you drink a lot of fluids and you have good bowel movements and get moving, meaning getting up, walking. At the hospital, if somebody is post-surgical, they've had surgery, we get them up moving so we get the bowels moving so they can get all that stool out of their body.
Wait, you mean you're about to be active? Currently active. Cut to the shot of them stirring the product into water.
Gurgle Max. Take a massive comfort.
Oh, God! Oh, there's regular on the carpet!
We have to provide this type of medication for individuals that are going to have a colonoscopy. That can cause cramping, and the cramping is related to the intestines peristalsing, as well as having some fluid dynamic changes within them as well to get all the liquid out.
I'm sick of being one-upped by Doug. Hurts. Hurts worse than a trip to the barber shop.
The barber, it's got the red and the white stripes. They used to do bloodletting back in the day. That's what part of their skill was. We see bleeding like this when a varicose vein is like ruptured open. It's a really intense pressurized stream, and it's just because of the back pressure.
Mom, my lips are too thin. Can I please get collagen injections?
Collagen used to be the more common injectable into the lips. They're different materials. It's hyaluronic acid. There's brands like Juvederm or Restylane. Those two end up lasting maybe 6 to 12 months versus the collagen injection, maybe 3 months, 6 months.
Meg, you don't need to change the way you look. You know, most of the world's problems stem from poor self-image.
It happens all the time in healthcare, in medicine. Somebody has a potential poor self-image and they may use substances, eat poorly, and a lot of these other issues stem from that, meaning poor control of chronic medical conditions because your self-image makes you not want to do things. It's messed up. Working out, lifting weights, it definitely is good for you. It releases your endorphins. So if you are feeling down or having a poor self-image and you need a boost or you want a boost, try working out, getting outside, or exercising. It actually could have significant and profound effect on your body, making you feel a lot better.
Don't take no for an answer, Chris. You're a Griffin, and a Griffin never knows when to stop. Clear.
Oh, interesting. You do not do defibrillation in the setting of somebody having a flatline. You do it only when you have VTAC or VFib. We don't have those paddles like that anymore in the emergency department. We have pads that stick on so nobody's actually holding. They stay in place.
Clear.
Oh, you saved my life, Doctor.
Clear.
Very rarely does anybody wake right up after a defibrillation because they're not really perfusing the brain very well, even though you're trying to do that with CPR. It takes a little bit of time.
I don't care. I'm coming with you. Well, you're not going to sit with me. Oh, come on. If I don't, I'll get stuck next to that guy with the heavy hands. Hi, doggy.
Oh.
Serves you right.
Some people just have big hands. Sometimes people may have big hands when they have acromegaly, like Andre the Giant. Their pituitary is basically overactive and could make your structures larger.
And a baby!
Skin being pulled back. When somebody comes into the emergency department and their eyes are red like that, we label it as scleral injection. That's the medical term that we use. Sometimes it could be really red due to a foreign body, could be related to a scratch to the eye or an infection.
Hey, Chris, hey, you remember that kid you said was bullying you at school? Well, here's his head.
You see the head just dripping with blood. I would anticipate that it's not going to be dripping much. If it's been in a bag for a little while, the blood will still almost try to congeal and stop. It's not under pressure anymore. It's going to form a clot, and it's eventually going to stop bleeding like that.
That's not even him. That's the deaf kid.
Oh,
That was
gosh.
sign language. I thought he was trying to defend himself with terrible karate.
That's so messed up. That is so messed up. There are situations in the hospital where we have individuals that are deaf and they have to use sign language. We actually don't have any interpreters in the hospital to help, but we have iPads that connect to remote translators of almost every single language.
You can't fire a writer in the middle of a show. That'd be like a doctor leaving in the middle of a surgery.
Help! I'm supposed to have surgery, but my doctor disappeared.
Oh, you would think if somebody's open like this on the operating table that they would be under general anesthesia, they'd be hooked up to the cardiac monitor and not being awake, but rather asleep on medications.
Okay, Josh, this is the shot you've been waiting for.
Oh, geez.
Okay, Derek, this is the shot you've been waiting for.
The individual is still having a laparotomy, which is basically an open abdomen. They do have appropriate, basically probably clamps in there that look like scissors, but then just a bunch of knives that looks like just sticking out of the abdomen, which wouldn't be appropriate.
How the hell am I going to quit smoking?
Doesn't look good.
Smoking could just quit me instead.
You could tell if somebody's been a chronic smoker for a while. They do have skin color changes. It doesn't just mess with your lungs, it messes with your whole body. Please don't smoke. There's no actual benefit for smoking.
Thank you for meeting me here.
Oh my
gosh. I have something very important to tell you.
I have something important to tell you, too. Peter, I think we should see other people.
Okay.
The cigarette has Peter's chin. I love it. This is a picture of a sonogram. We don't print these out in the emergency department for individuals. Maybe in the office at the OBGYN they might. But most of the time, if somebody wants to see a picture, we'll let them take a photo of the screen.
Oh, look, Chris. Here's your costume from the year you went as a condom.
What the hell are you supposed to be?
Oh, that's so funny. Okay. A condom is a barrier device. If used appropriately, has a pretty high probability of reducing pregnancies or unwanted pregnancies, as well as transmission of sexually transmitted infections. Oh my gosh.
I can't believe it. You've become a wild animal. You're like that tiger from Siegfried and Roy.
Oh.
I think we all know the answer to this, but should I get tested?
Siegfried and Roy, one of them got mauled by their own tiger, so here he's in the hospital. Wearing a cervical collar, so if the collar is still on, that means that there's a cervical fracture. Multiple abrasions, typically those would be covered.
I haven't felt this powerful since I got to decide which ant lives and which ant dies.
Oh gosh.
You shall battle to the death, and the winner will be given his freedom. Why are you looking at me like that?
Peter, would you like a glass of... Oh, my God!
I need to talk to Coyote Peterson about insect bites and ants. We don't see this in the emergency department. Most of the time when somebody gets bitten by an ant, we will see them due to the fact that they're having an allergic reaction and have to deal with the anaphylactic component.
Peter, you are taking Stewie to the park. It'll do you good to spend some time with your son.
I spent lots of time with him, Lois. Just last week, I took him to the doctor.
Mr. Griffin, you're here to get your prostate examined?
Yeah, this is me.
No. It's very funny that he brought his son to the doctors, which he shouldn't in general when people bring family members into the ER when they're a patient. We don't like that because it's a sick place. There's infectious diseases, so we don't recommend it.
Besides, it's bound to go better than my deep sea training. Well, we got a long time in this decompression chamber. You guys mind if I turn on the radio? Peter!
Oh my gosh.
Hey, excuse the hell out of me for trying to brighten your day with music.
Oh my gosh. We use different type of decompression chambers or hyperbaric chambers. A lot of times carbon monoxide poisoning is one of the indications that we will dive somebody.
You idiot, use your brain. You're an idiot.
I'm not gonna get caught. Yep.
Stop. Oh man, we're gonna need some butter or something.
Eyes popping out like this, so the anatomy is wrong. You have 6 muscles of the eye plus your optic nerve that comes in with the blood vessels, so they wouldn't look like this and swing it around. They wouldn't come out that far.
Oh man, this is gonna be great.
Oh, are we watching a movie?
The lab results are back. You've tested positive for nymphomania.
Oh
no!
There's no lab test for such a thing.
What should I do?
Take 2 of these and call us in the morning.
So bad. Oh my gosh. Teeth fairy. Oh, tooth fairy. Oh my gosh. Oh, gross.
Yeah.
That is so gross. All of these teeth are molars that we can see here, so they have multiple roots versus incisors. Oh, there's like 1 or 2 incisors. But these were definitely teeth that were pulled out. If you see the roots versus if they were baby teeth, you wouldn't actually see the root as much.
I can make things happen when I want to. Just ask my twin brother.
And here's baby boy number 1. I understand you've decided to name him Stewie.
It's just funny to me because Stewie comes out of the womb, no umbilical cord, and it's the cleanest delivery on the planet because there's no blood or fluid on the baby.
1 more to go, and here he... Oh dear.
Oh no, did Dave not make it?
There's something called vanishing twin syndrome where twins, triplets, disappear, get absorbed by the other baby, die in utero. There are many different scenarios that could potentially happen, but it actually is a true thing. It's just Family Guy takes it to a whole nother level.
Mayor West is crazy. He should have been locked up a long time ago.
Yeah, there's definitely something off about him. I'm his physician. Okay, now we'll just test those reflexes.
Hey, did you hear that? There's someone out there.
Not even hitting the reflex in the right place. You're supposed to hit with the reflex hammer at the patella tendon. Why do we use the reflex hammer? We're checking for deep tendon reflexes.
Do you have any experience helping out people with special needs?
Well, I did work for that old lady down the street.
Meg, could you come here, please?
What is it?
Oh my
Could you
gosh.
see if I'm getting a bed sore on my back?
Bed sores are basically sores that occur from laying in the same position and on the same tissue for an extended period of time, and the tissue starts breaking down.
Sure.
Oh, that is awful. This is very common. Unfortunately, once they start getting pretty deep, it's really hard to recover from unless you're really aggressive at treating them. I've seen them all the way down to the bone.
It's in the bone. It's in the bone.
Basically a sign that somebody's not helping them and rotating them as best they should.
Look, I even brought Tom Sizemore's Game of Life. Scoop someone's urine from Starbucks toilet to pass drug test.
Feels like we should be moving these pieces backwards.
People do try to cheat a urine drug test. They'll use toilet water without any urine. Some people will dilute their own urine. If we're looking for something, it's not because we're trying to get you in trouble. We don't share this information. Just give us a normal sample. It'll help you at the end of the day.
Now I wish I just stayed home and finished my remake of Inside Out.
I'm Joy.
I'm sadness.
I'm anger.
I'm disgust.
I'm poo.
When you have poop, it's not necessarily an emotion. Poop. The amount of people that come to the emergency department that have abdominal pain because they ignore their poop signal, and once I explain it to them, they're like, oh my gosh, it clicks. Yes, I ignore the signal. I'm too busy. I can't go to the bathroom, and then I never catch up.
Oh, I need to use the bathroom.
Yay, I win!
What the heck? Oh my gosh. When you get the signal of the pressure down below or you feel like you got gas,
How the hell do they know that I got gas?
that's probably a body signal to sit down and try and go to the bathroom. You shouldn't have to force it. You shouldn't have to push really hard. You should definitely not be passing out on the toilet from trying to strain too hard.
I haven't been this excited since I abused those caffeine pills to get ready for the big show. Everything will be fine as long as I take one of these.
Pills? You actually are taking drugs? Stewie, give me those.
I can't, Zach. I need them to sing.
Oh my gosh. I actually have seen this episode of Saved by the Bell. Do they make such a thing as caffeine pills? Yes. What is a dose of caffeine that you should stay under? Should be below 400 milligrams in a day.
I'm so excited. I'm so excited. I'm so scared.
I grew up with Saved by the Bell, and it's literally the exact same thing.
I'm so excited!
Girls, it is so nice to be part of a group again. And I'm having the best time, especially yesterday when we all got mammograms.
Can men get a mammogram? Yes. Can you get something called gynecomastia? And then there's always the potential of the dense tissue turning into cancerous tissue. In the US, 1% of all breast cancers are actually male. Ow!
If I have cancer, we're all going to Brazil.
The machine is awful.
How do you know about the machine?
Literally, it does this. It takes breast tissue and squashes the heck out of it. We're looking at it to basically be a screening tool looking for breast masses.
Yes, and there's so much to learn. For example, did you know that Jesus didn't really die on the cross?
So what was the cause of death?
Cocaine and severe trauma to the colon.
Yeah, I'm gonna need to see those forms.
We're assuming trauma to the colon would be physical abuse, potentially. It wouldn't necessarily cause death. Cocaine basically can cause hardening of your arteries, can cause cardiac arrhythmias, and can cause cardiac abnormalities, potentially even death and heart attacks.
I know, honey, but if you give it a little time, I'm sure you'll get over her. Just like you got over your hamster dance Tourette syndrome.
Excuse me, Mom. Could you please pass it? Dee-da-dee-da-dee-da-do-do. Dee-da-dee-da-do.
Tourette's is abnormal movements, uncontrollable movements, or vocal things that an individual has that's like a tic. Treatment of Tourette's, trying to minimize the symptoms. There's behavioral changes, cognitive aspects. There are medications out there you can potentially try, and even like deep brain stimulators. So there's a lot of options.
His brain ain't right, but it's fun.
A lot of times Tourette's does improve into adulthood, so it calms down, but not all the time.
You're making a smart move, Quagmire, like I did when I wanted to get out of that boring meeting.
Which will offer us a good cost analysis comparison that I think we'll be able to utilize as we move forward into the next fiscal year.
Please do not stick things up your nose. People do come to the emergency department with foreign objects in the nose. Not necessarily bleeding due to a foreign object in the nose, either an infection or just a foreign body in there that typically we can get out. If we can't get it out, somebody can actually go to an ear, nose, and throat doctor.
Hey, guys, I gotta leave. I got a nosebleed, and I don't work here.
This is a laceration to most likely nasal septum. There's a lot of blood vessels there. It's very frail. That's where most people bleed. Kiesselbach's plexus. So if you do get a nosebleed, remember, pinch your nose and lean forward. If you lean back, the blood's going to drip to the back of your throat. You're going to continue to swallow it. You might cause yourself to vomit because of the nausea that the blood causes when it's in your stomach.
All right, if that's what it takes to ride that ride, I am going on a diet. And I'm not stopping till I look as good as my great-aunt legs go all the way up, Griffin. Hey, baby.
Some people say they just have really, really long legs versus like torso. And it is true. Some people's legs are longer in proportion to their torsos and vice versa.
Do those legs go all the way up?
Why, yes, they do.
Oh my gosh. In medical school, we did gross anatomy. That's when you're doing dissections of a cadaver. Every single person was different. People have different anatomies and different structures. It is not abnormal.
My God, who could be at the door at this hour?
I don't know, but this late it's got to be bad news. Everyone knows you always get bad news in the middle of the night.
Yep, okay.
Wake up, wake up, wake up!
Huh? What?
You have cancer!
That is so messed up. So no, we don't do that. It is the job of the doctor when you do find cancer to tell an individual what you found. There are times when it might be in the middle of the night, but a majority of the time, individuals are awake at that hour. In the emergency department, the lights don't go out.
Okay, go back to sleep.
Wait, I have questions.
It's very late.
I always tell patients when we give you news, you will potentially feel the shock of it and go through a lot of different emotions really fast or none. And it's really important to write your questions down because sometimes you'll forget while we're there, but then remember when we leave.
I used to do the same thing to my parents. The problem is they pushed back, and the results were not good.
Mr. Peterschmidt, we pumped your daughter's stomach and we found vodka, Rohypnol, a fair amount of DNA that is not her own.
What? Oh my gosh. Pumping stomachs, we don't do that anymore. Trying to get all the contents out. So you're actually just putting, most likely, a nasogastric tube in to try to suck out contents.
And a class ring.
Harvard?
I think it was SUNY something?
Oh, I don't want to hear anymore.
Oh my gosh, that's hilarious. If we are concerned about something you might have ingested, a lot of times we will give charcoal, which needs to be done usually within the first hour of ingestion. You need to be kind of awake when that happens because we don't want to just put it in there and you increase the risk of aspiration, vomiting.
Good morning, boys. What's in store for today?
Well, I thought we'd start with a vigorous power walk around the neighborhood.
Peter has his vestigial parasitic twin. Partial twin that didn't form on its own. Parasitic because it's living off the main body. We don't see these very often. It's very rare. I've never seen it in my career.
Whoa. I was thinking we would just watch Dr. Oz and eat cold cuts off our stomach.
Nice. Oh my gosh.
Those people ain't taking good care of themselves.
Cold cuts, probably a decent source of protein. There are better out there. It's processed meat. It has preservatives in it. It has things that aren't healthy for us in the long term. If you can avoid eating it, I would. But again, there are other worse things out there. And then obviously there are a lot better things out there as well.
Hey, Megan. Oh, hey, guys. Wait, did you just call me Megan? That's your name, isn't it? Well, actually, Meg is short for something else.
Peter, would you give this to the nurse?
Uh-huh.
Megatron! Awesome! Megatron! As an ER doctor, we occasionally deliver babies, but I'll have to say, I've actually never had to see or fill out a birth certificate. In the United States, you have 5 to 10 days to name your child after birth and submit the birth certificate.
All right, I don't care if I die. I mean, maybe in my next life, I'll come back as an airbag or something.
That's hilarious. Car accidents are no joke. The airbag can cause issues. It can cause burns from the reaction that it has for that explosion. It actually could break people's nose. But if you don't have an airbag and you're just dealing with maybe a seatbelt, you're going to potentially have a worse outcome.
It's okay. It's okay. Peter's got you. Don't you worry. Everything's gonna be all right.
Is my wife okay?
No, the ski boots that was in the back flew up and chopped her head off.
Oh my goodness. Your adrenaline is rushing. You're not really feeling pains yet, but as the adrenaline wears off, a lot of neck pain, neck discomfort, headache. We do worry about cervical spine injury, so if EMS is on scene, they're going to probably put you in a C-collar, and then we'll evaluate you in the emergency department.
So I'm gonna have herpes for the rest of my life, huh?
Yep.
Yeah, but most of the time it won't even be an issue.
There's herpes simplex 1, herpes simplex 2, and a lot of other viruses out there that we have different names for are also herpes viruses.
It only really flares up during periods of great stress, like your wedding day or a big job interview.
Yep.
So, what would you say some of your weaknesses are?
Oh, that's pretty gross. Yes, you can have reactivation of the herpes virus due to stress, not just by mental stress. You can also have physical stress. When you're sick, really ill, compromised immune system, all things can kind of make it erupt.
And my mom? Well, let's just say she was a little promiscuous. In fact, I think my problem started the day I was born.
How do you feel?
Horny. Really horny. Could you put him back so I can push him out again?
I was born 9 times that day.
Yeah, you're actually suffocating the baby because even though you still have the umbilical cord attached, after the baby has taken that first breath, the pulmonary and cardiovascular system has now changed. The foramen ovale shuts closed. You're not getting the blood that you normally would from the umbilical cord anymore.
Ah, they'll be fine. He'll bounce back, just like Humpty Dumpty did after his fall.
My God, it's a miracle. You were able to put me back together again.
I like the x-ray in the background where you're seeing like, okay, all the cracks of the shells, but then yet we still have some bone of like the arms and the hands and the feet and the legs. So really interesting. And a lot of movies, TV shows have people in like these full everything cast. We don't do that.
Yeah, I'm just glad I didn't die from that weird sleep breathing thing I have. Ah!
Oh my gosh, I feel like my wife would do that to me. No, I'm just kidding. What she was doing was checking his carotid artery to make sure he had a pulse. Could it be a night terror? Maybe. Could he have sleep apnea? Maybe. A couple different common denominators there.
See, Peter, it wasn't so bad.
He just has a bandage on his deltoid, so maybe he was just getting a booster shot for something.
Yeah, except for having to sit next to that screaming autistic lady in the waiting room.
The ER is filled with so many different types of people. Unfortunately, yes, the waiting rooms can be a little chaotic, but we do our best in the system to kind of work people through and get them in and out as fast as possible.
Well, when I find that person, I'm gonna strangle him. I had a life, and he took it away from me. I don't remember it, but I bet it was pretty good.
According to a lot of comments that I've read, Joe had an injury because of getting shot in the legs versus I thought it was a spinal cord injury. Tell me which one it is. Let me know in the comments.
Yeah, me too. I bet I was a doctor who had to deal with a lot of serious stuff, but always found a way to keep things light.
Oh my God, she's beautiful.
Yeah, she is. It's not yours. Yours died.
Oh my gosh, his bedside manner is pretty poor. You would never do that. They keep track of babies in the hospitals actually really tightly. There's something called Code Pink.
We got a code pink, people!
There's a potential of a kid being abducted.
We now return to Downton syndrome.
Down syndrome is a genetic abnormality having to do with your chromosomes.
Well, if I must accept your proposal in order to break the entail and save my family's estate, then yes, I will.
It's gonna be
marry
messed
you.
up.
Yay!
Knew it was going to be messed up. The life expectancy for somebody with Down syndrome is shorter, and they do have some other anatomical things that we do have to worry about, especially when it comes to like protecting their airway.
The Travel Channel presents Backpacking Through Europe with a bow-legged man in short shorts.
Hello, come, let's see some beautiful sights together. Hello, tree. Thank you for shade.
Let's talk about bow-legged. We see this a lot in children, but most of the time children grow out of this. There's something relating to either hip development or knee development that you have this when people's legs and knees are very far apart. There's something called a varus versus valgum.
I can't believe this. And it's not like it's the first time you made a big family decision without consulting me.
Planned Parenthood is appropriately used for women's health in general or males as well. Good for testing, STIs, birth control, simple infections, medications. What's happening?
Yes, I'd like to see your quietest doctor.
What? Could they also offer services such as procedures or medications relating to ending pregnancies? Yes, potentially. It just all depends on the area that you're living, the country that you live in. This show is giving it a negative view, but it provides very good positive care for people who need reproductive health services.
Hey, you know, I heard when you drink at high altitude, it hits you even faster.
Alcohol hits harder at altitude due to lower oxygen levels and dehydration. I gotta recommend Poor Decisions, a doctor-formulated pre-party supplement to help your body pre-game smarter and bounce back better. Check it out at lifehappens.com and on Amazon.
Woo! Party! I love you guys. You don't know how much you mean to me. You think you're better than me? Why can't you hit a curveball? I've done nothing with my life.
In combination with the decreased oxygen, in general, you might feel a little bit more woozy, lightheaded, dizzy, coordination being off. That's why you feel maybe you had a little too much too fast.
I replaced Peter's I can't believe it's not butter with real butter.
I can't believe it's not butter is a chemical. If you can avoid using chemicals as much as possible when it comes to food, I would highly recommend that. Butter in and of itself, in moderation, not bad for you, but anything that you overdo could be bad.
I don't know, Doctor.
Triggered him to have a psychiatric break. Somebody actually comes in extremely agitated, confused. We have to look at things not just from a psychiatric standpoint, but also a medical standpoint. So we're going to do both in the emergency department. But in general, we're going to try to get the individual to calm down.
Looking back, I think it may have been real butter.
Your husband murdered 3 children.
What? Try not to use full-on physical restraints like that. We may try to use physical restraints only in the setting of trying to give them medication to calm them down after checking to make sure that they don't have any allergies to medications or on medications that might interact with the one that we want to give.
They haven't worked in 8 generations. All the kids have drug problems. Most of them have OD'd.
Different drugs come at different times. Lately, one of the bigger things that we always worry about are opiates. That's become a real issue, especially here in the United States. And people can basically overdose, even accidentally, and end up having such a decrease in respiratory drive, which they stop breathing and then can go into cardiac arrest and die.
That's terrible.
Well, not all kids make it, Lois. Just ask the Sugar Smacks frog.
I'm sorry. I'm afraid you've lost 2 more. What should we do about the graves?
Dig 'em.
The Smacks, I believe they're referencing a cereal.
They dig 'em.
I don't think I ever had them as a kid. Have you ever had Smacks as a cereal as a kid? Let me know in the comments.
But we told Chris we'd be there when he wakes up from surgery.
All right, we were able to fix your hernia, but you've got to stop lifting sewer hole covers.
A hernia basically is where your intestines pop out of a weakening within the abdominal wall somewhere. Most common for men would be an inguinal hernia. You can have femoral hernia, ventral abdominal wall hernia, spigelian hernia. Very common one that we also see is a hiatal hernia, where the stomach go up into the chest cavity and cause people to have horrible reflux.
But the Ninja Turtles live down there. I'm friends with them.
Hey, fat I brought you flowers. But stay out of the sewers. We're trying to work down there.
Thanks, Donatello.
So funny. Oh my gosh.
I love being a turtle!
Look, I'm just happy you pushed me, because now I can't wait for that tournament. I know, it's going to be great. And I already know exactly where I'm going to put that trophy.
So the baby died?
Yeah, the baby died. But look, first place.
What in the holy cow? Foreign body in the rectum, not an uncommon thing that shows up to an emergency department. Our bodies are negative pressure. So when you put something in an orifice, once it goes to a certain level, it gets sucked up into our bodies. We'll get an x-ray, see what everything looks like, make sure there's no bowel perforation. In the emergency department, we'll try to get it out. Sometimes we need to use sedation.
We gotta find out where that potty is and get Meg out of there.
You're right. God, what happened? It seems like just yesterday she was born.
Mr. Griffin, would you like to cut the cord?
Sure.
Oh gosh.
Okay, that wasn't the cord, and now you've got a girl.
Stop it. Come on, the cord is very obvious.
Come on!
They do circumcisions at the hospital often, usually within 1 to 2 days of a baby being born. There's been a little bit of a change moving forward that people are doing it less, or they're doing it in their homes, whatever the reason.
It's all about helping people get well, just like Doc Martens.
So, how are you feeling today?
Terrible. I've got blurry vision, I feel cold and clammy, and the nurse told me there's blood in my stool.
Sweaty, blurry vision, blood in the stool. Gotta figure out why. Does he have perforated bowel? Does he have diverticulitis? Does he have cancer? Is he severely anemic, which would really lead us to the other symptoms of dizziness, sweating, or is he septic and hypotensive because he's got an infection that's bleeding as well?
Have you tried wearing a lesbian shoe?
What?
Put this man down for a pair of lesbian shoes.
Wow, that's hilarious. Doc Martens. He doesn't need just a pair of shoes. Give fluids, probably give antibiotics, and probably needs a colonoscopy sooner than later to see what's going on with the bowels.
Just when I thought he couldn't get any cooler, he goes, holy!
Oh no, this is so real. No joke, this actually does happen. Wingsuit, diving, flying, jumping is high risk. Things can happen. They don't come to the hospital. People die on scene. And obviously here you see the body just got destroyed.
Oh my God! Oh my God! What? There's almost nothing left of him! And I just know I'm gonna be the one to have to identify the body. That's
awful.
That's awful.
People sometimes have to go to the hospital to identify bodies. In the emergency department, we don't see that very often. People will come to the emergency department after somebody has passed away to visit before they go to the morgue, before they then get transferred to funeral home. But they actually stay in the hospital for more time than you actually think.
Poor guy. He looks like a bowl of tomato soup.
Guy next to him died in a fire. He looks like a grilled cheese sandwich.
Oh, these two poor souls are the best combination for a rainy Saturday.
Let's say you didn't crash going 140 miles an hour or whatnot. A lot of times the more common injuries that we see are like ankle fractures or sprains or lower extremity fractures. Sometimes if you land directly on both heels, you can actually get the energy to go straight up through the vertebrae and actually fracture any of the vertebrae of your back or your neck.
Every dollar I make, one goes to me and one goes to charity.
I'm gonna rent a Ferrari and cruise the pier. You want in?
Well, cancer's not going anywhere.
Donating to a charity so you don't know where it's going to go. Make sure if you do donate that you know directly how it's getting used, because it's really important. Some agencies and places definitely aren't as descriptive where the money is going.
I'm sorry, Billy. You're $1 short of being able to afford the surgery.
Oh my gosh. Cancer continues to evolve and is really complex. It's not just so simple that here's a medicine and it goes away. Once a single cell goes rogue in the body and is causing issues, it can hide for a while, it can replicate continuously, causing issues. It's actually a really hard disease process, and the biggest thing is actually prevention, if you can, and early detection.
We're going to go down 20,000 feet and pants James Cameron while he's excavating the Titanic.
20,000 4,000 feet. I'm not an expert of the deep seas, but I think it's like close to like 4 miles. That's really down there. Make sure you're in a vessel that's able to handle the pressures that are down there. I think James Cameron went all the way down to like 35,000 feet. That is impressive. My ears would not like that. Divers have to make sure that the descent as well as the ascent is controlled and slow, because you can get the bends, you can get gas that's going into the bloodstream, into your brain. So you have to be really careful. What are they doing? What did you just do? Oh my gosh. We just see intestines everywhere. And they did a kind of a good job. At least it's not all like just one string. We see multiple pieces. It's all one glob together. The reactions are like, oh, let's get out of here. We all believe that if there's blood in the water, sharks are coming after the humans, but typically sharks don't like human blood. They like more of the marine animal type of blood.
Where's the slide?
Just eat this Starburst.
What the heck?
Wow, lemons, oranges, cherries.
Oh my gosh, remember that? We have water parks in California. We get people that show up to the emergency department with injuries, usually like either infections or scrapes and bruises, but no massive head injuries and broken bones like this one.
I don't think that was a Starburst.
Peter's bleeding from the top of his head. What would you first do? Get the bleeding to stop on scene, right? So direct pressure with whatever you can. And then you want to assess the individual, see if they're nauseous, vomiting, altered, obviously if they're awake or not.
I've got to get out of this house or I'll be in worse shape than John Goodman.
I've got your EKG here.
How does it look?
Well, it spells out pancakes.
Oh my gosh. I like John Goodman.
Thanks. I needed that.
The EKG is really cool. It actually gives us a reading of 12 different areas to help identify if there are vessels that are abnormal.
I'm recommending you go on a strict diet immediately.
Nope. Horses that make it look like I can walk, take me to Hollywood.
Is there electrical abnormalities to identify that there might be ischemia going, where there's decreased blood flow? And we can actually see that on an EKG. We can correlate it to, are you having symptoms or not, plus or minus, and lab abnormalities, and get the person to the cath lab right away.
I thought maybe you and I could finally go fishing like we've been talking about.
Ah, sorry, Chris, I can't. I got insanity practice. Pinwheels in my head, voices, angry fish.
I've yet to see a patient in a straitjacket. I don't believe they use those very much anymore. I've never worked in a hospital with a padded room before, but me plus about 20 of my medical student colleagues actually had free housing in the shutdown side of a psychiatric ward of the hospital.
How's he doing?
Not good. He still thinks this is practice of some sort.
Patients can have acute psychosis like this. We will try our best to actually give medications to help calm the individual down and maybe help get the psychosis to pass. Oh, the Boston. The Boston Red Sox.
Go Sox. Go Sox.
Peter's brain.
Yeah, this is the muscle department. What the hell is he doing?
Apparently he's trying to sprint.
Sprint? He got winded walking to the plate.
If you feel like you're getting short of breath by just walking, that is a massive red flag that you need to get checked out. Make sure your heart is okay. Make sure your lungs are good. And then if you are severely decompensated from a physical standpoint, you need to start moving. Just walking will be so beneficial for somebody in that state.
Has he had any water?
No, he told his wife there's juices in the hot dogs.
Oh my gosh, that is hilarious. No, that is not adequate hydration. Yes, there are fluids within some foods, but no, we need to be drinking 64 to 128 ounces of water probably a day.
I got no choice but to call for a complete muscle failure.
Shut down is your fall to the ground. Oh my gosh, passed out. So we had a syncopal episode with a head injury, very common. Out in the sun, getting dehydrated. We either call it heat exhaustion or heat stroke. We do cooling measures, put cool cloths on them and like a fan to evaporate the heat off, as well as using cool IV fluids. And if it's really bad, you put a Foley catheter in somebody and you have cool fluids going into the bladder to try to cool somebody off.
Without Quagmire, we're boring.
Oh, come on, that ain't true.
Yes, it is. He had all the fun ideas. Remember, he even took me parasailing.
Oh, fun. I'm still confused on the official reason why he is paralyzed. People say that he was shot in the legs and they don't work versus back injury. Let me know in the comments what his real injury was that made him paralyzed from the waist down.
This is awesome. It's like I'm flying. I've never felt so alive!
What would you do if somebody had bilateral lower extremity amputations in the field? This would be immediate no-brainer. Just put tourniquets on them. Legs are gone. You can't replace them. And at this point, you're trying to prevent blood loss.
Oh, if only I had a pair of legs.
Oh.
All right.
It was the fish part of me that wanted him.
Wow, aggressive.